Thank you all so much for joining us for COVID in Classrooms, a panel discussion with the Oklahoman. I'm Dana Branham, and I'm a health reporter for the Oklahoman.
And I'm Nuria Martinez-Keel, the Oklahoman's education reporter. We're joined tonight by health and education leaders for a back-to-school conversation about the challenges ahead for this school year, given how COVID cases are rising.
So I'll kick us off tonight by introducing the doctors on our panel. Tonight we have Dr. Donna Tungu, a pediatric infectious disease specialist with OU Health, and we are also joined by Dr. Mary Clarke, who is the president of the Oklahoma State Medical Association and a family physician in Stillwater. Thank you so much for joining us.
And we also have two school leaders with us this evening. From Oklahoma City Public Schools, we have Deputy Superintendent Jason Brown, and we also have Matt Holder, Superintendent of Sulphur Public Schools in southeastern Oklahoma. Thank you both for joining us today.
Awesome. So I wanted to start us off with a question for Dr. Tungu. That question, is COVID a risk to kids, and does the Delta variant change in the way kids are being affected by COVID?
So yes, COVID's also been always a risk to kids. We've just known that they get infected less frequently and with less severe disease and deaths. Unfortunately, the Delta variant has changed that. We do know that children are being admitted at much higher numbers than they were last year. I think Florida now has 135 children admitted. We have children admitted this year who weren't admitted last year, who were previously healthy, who need oxygen because of COVID-19. Arkansas has children admitted, so it's a different situation this year.
And now for Jason and Matt, I was wondering can each of you take us through what your school districts are doing to try to bring kids back into the classroom safely, and what contingency plans do you all have in place if an outbreak were to occur?
Matt, please go ahead.
So, we have, obviously it's very concerning as far as a school leader, and looking at how to bring back the kids safely. We've put a number of things in place last year, and I think we've built off of that even more this summer. Just ensuring that we, probably one of the biggest things I think we've really tried to do is to isolate large gatherings, keeping kids separated as much as possible in the classrooms, being able to not put them together with 300 kids. We had, before we served in our cafeteria, prime example, we used to serve 300 plus kids in our cafeteria at the time, and we trimmed that down. We spread out the tables where they're just not around those large groups as much as possible. As far as if an outbreak happens, we've experienced it last year, and I think we have a great plan as far as moving virtually if needed. We didn't do that last year. We did take out a week of school just because the cases had risen so high. We've got some things in place as far as that goes if we need to take a break for a moment, if we need to extend the school year out, whatever those cases may be moving forward.
And then Jason, if you might be able to take us through what OKCPS has in mind.
Yes, very similar to Sulphur Public Schools. We're utilizing the same contingencies that we had last year, with a couple notable exceptions, that being the requirement for masks that I'm sure we'll talk about. But we are still strongly recommending masks. But our contingencies and our mitigation strategies that we had last year are still in place. We were very happy to be able to get our ionization system installed in all of our instructional spaces and workspaces for our both staff and students. We still are providing a PPE at the classroom level, at the office level, and then at the district level. We're making sure that anyone who needs a mask has a mask. We obviously have plenty of hand sanitizer. We're still spacing. We still have, again, with the notable exception of the mask requirement, most of our mitigation strategies that we utilized last year. The things that we would normally do at the start of a school, for example, big gatherings similar to how Mr. Holder stated, maybe large convocations or first day assemblies, we're forgoing those. We are still asking students, staff, and individuals to socially distance, and still having strategies by which we address how kids walk down the hall, how kids utilize the lunchroom, how we do recess. And so, again, still trying to keep all of those strategies that are suggested and recommended by the CDC in place. Again, probably the most notable exception would be just the mask requirement, of which we had all of last year whenever kids were in school. And this year, we are still asking and recommending that our staff and students wear masks. But obviously, because of legislation here in the state of Oklahoma, we are not able to require or mandate that either our students or staff wear masks on our campuses.
Got it. And Jason, you touched on this, and that brings me into a question for Dr. Clarke. I know you and some of the doctors that we hear from on the Healthier Oklahoma Coalition calls have stressed the need for an emergency order from the governor so that schools can require masks. And so I wanted to ask, and Dr. Tungu, feel free to jump in on this as well, why is masking in schools important, and why would a requirement rather than a recommendation be the way to go?
Let me take the first question. Why are masks so important? We know that the virus spreads very quickly, and especially the Delta virus, which is currently the majority of cases that we're seeing across the country, including Oklahoma, does spread easier than the wild type. And there are, in some studies, up to 40% of people have no symptoms whatsoever. So there's no way to really know who's infected. The only good strategy is, if I can't tell who's infected in any one day, is to make sure that everyone around us that's going to be in a space be masked up, whether we're vaccinated or not. Now, I understand that children under 12 cannot be vaccinated, but in high schools, some of the high school children can, but that really, we still wouldn't know who would be infected because there are some breakthrough infections. We know that the emergency order would give us a little more leeway to help schools require masks. And I know there's a big thing, but even if we don't get everybody vaccinated, which is going to be the most important thing, getting everybody in a mask we have the data, it works against all of that misinformation. Mask does work to eliminate and significantly reduce the spread of the virus. So if we could get an emergency order, that would be fantastic. I don't think that's going to happen. So in the meantime, we have to really encourage everyone to send their children to school with masks, be positive. Staff and other employees be good role models to our children that are going to be in schools. And as we get through this school year, we're going to be making recommendations that are probably going to be a little different than what we're saying today. And I commend the educational system in Oklahoma, because they have had to work with the changing landscape in a heartbeat, and it's been very difficult. So we just want everyone to be as safe as possible, and hopefully turn this incline into a decline sooner than later.
And
Yeah.
Oh, sorry, Dr. Tungu, please feel free to jump in.
No,
here.
I think the only couple things I would add is, Mr. Brown and Mr. Holder had mentioned the schools have so many other mitigation strategies that they need to be working on. And if students can just be required to wear masks in the door, that's one less thing to worry about. And, there's no way, like, figuring out who's vaccinated and who's not vaccinated. And, children have to deal with bullying and different things in school. And so it doesn't make sense to have schools where some kids wear masks and some don't, even though that's the situation that we're in right now. But with how much more transmissible this variant is, I just second everything that Dr. Clarke just said. And we already have evidence from summer camps all summer of outbreaks happening. And we have evidence from Arizona where schools are already open of outbreaks happening. And so we know the information. I don't know why we wouldn't act on it now.
And the legislation that we've been referring to is Senate Bill 658. So to our two district leaders, what effect did SB 658 have on the way your district is preparing to get back into school? And does it pose challenges for you? And let's start with Jason here.
Right. It does, because obviously our board and superintendent have really tried to do a yeoman's job as far as keeping track of what's happening in the changing landscape of COVID, and are ready to have our district pivot and make decisions. But what the Senate bill did is it took that decision making out of the hands of those who are closest to the issue. And so we're not able to then mandate mask or require mask. And someone already spoke to it. That's going to set up a situation where some students choose to wear masks and some students choose to not wear mask. And while we obviously respect individual choice, we also know that given a normal school environment, sometimes individuals' personal choices are questioned. And you would hope that the last thing that a person would want to discuss or question is someone's individual choice when it comes to health. It would help us so much, especially those who are not even eligible for vaccination, if we could just require them to wear a mask. We didn't find that to be an issue last year when we were in school. We didn't find that to be a problem. We provided masks for those that didn't have it. We didn't see pushback from either our students or our staff. They were really troopers and they did a wonderful job. I know that no one really likes wearing a mask, but our staff and students did a tremendous job. And we're confident that if we could require it, that our students and staff would abide by that requirement and mandate, and we would see all of our staff members and students mask up. And as we've heard from the health professionals, we know that's one of the primary ways that we can help prevent the spread of COVID-19. So it truly handcuffs us in our ability to make local decisions on what's best for our kids in our district.
And Matt, let me just repeat the question for you here. What effect did SB 658 have on the way your district is preparing to get back to school, and does it pose challenges?
I think if the biggest thing it's done for us is we've really wanted to just make sure that we are focusing on the other mitigation strategies even more so maybe than we did last year. Didn't mention, Jason mentioned this too, but all kinds of sanitation, hand sanitizer. We've just put a lot of focus on those things that we know that we can control at this point in time, and that's really what we're doing to move forward as far as this school year goes. Through this whole year and a half, it's been a changing landscape. Day in and day out. I reference it being a snow day every time you wake up, because you don't know what you're going to get whenever you get to school that day, and so we're just really trying to do the best we can with what we can do, and I think we've got our community, I think, is bought in and trusting in what we're doing here. I think in saying that, keeping kids home when they're sick, quarantining their families whenever they do have a positive case. Those are the things that we can control, and that's what we're going to really focus on moving forward for right now.
And Matt, I have a follow-up question here specifically for you. Rural cities have consistently enforced fewer COVID regulations. You mentioned your community has been really trusting to your district, so I'm interested to hear your answer to this question. Was there more community resistance to COVID precautions in your district, and if so, how did you handle that?
I don't know that there was necessarily resistance. I think everybody wanted their kids in school. I think in a rural community, we have some differences than being in a metro area, and that we don't have large buildings that we have hundreds of people working in. The biggest place where we have the most people at is a Walmart here, and I mean that respectfully, but they're, our businesses, our small businesses, they're our main street, our downtown. I think that our community really, recognizes that we are trying to do the best we can to get their kids in school. And that really is the crux of it.
Awesome. Well, thank you all. we want to shift gears a bit and ask some questions that parents have sent in ahead of time and give people who are watching live a chance to ask questions. So first up is a question that we got ahead of time from Tara, who lives in Choctaw. And her question is, how long does immunity last in children who've already been infected with COVID? Would either of the doctors want to jump in on that one?
I can give you adult data. I'm going to let Dr. Chongo take that one. I can tell you adult data if anyone's interested in that, but I don't know the pediatric data, so I'll let you field that one.
Yeah, so immunity after COVID-19 is still a question that I think we all have. We know that with the first SARS-CoV-1 that people still 18 years later have evidence of immunity after having been infected with that. The question we have now is that with this strain that we're dealing with now in 2021 being so dramatically different than the original strain, how much protective immunity do you retain from having had the infection last year? And so the answer is we know that there are people who've had COVID multiple times. And so that's why we advise people, even if they've had COVID-19, to be vaccinated.
Gotcha. And Dr. Clarke, I would love to hear the answer on adult data if you have a second.
We do know that for the first 90 days after being diagnosed with a COVID-19 infection, that the antibodies to that virus are relatively high. After that, it significantly wanes. So initially when the vaccine came out, we were recommending people who had been infected to not get the vaccine for 90 days. And a lot of people felt like that was because there was a problem with the vaccine. We missed a little bit of an educational opportunity. It was not because we were confident in the long-term immunity, that 90-day immunity. It was because we had a limited supply of vaccine. And if you had immunity for at least 90 days, we could hold off on that vaccine and make sure we get other people who have not had the infection. At this point in time, we are still seeing about that 90 days for the virus, and it dramatically drops. And we're still saying, if you've been infected, go get your vaccine. And generally, you don't have to wait 90 days, but most people don't want to get a vaccine when they're sick. So we generally say, when you're feeling better, head out to get that vaccine because it is readily available. It is actually quite interesting because this virus versus the vaccine does not carry as much long-term immunity for significant reinfection, but the vaccine has had very, very good immunity long-term. So we're seeing the vaccine a little bit better right now than long-term immunity.
Interesting, thanks.
So I have a question here for Jason and Matt. This one was sent anonymously from someone in Oklahoma City. They said, for school administrators, are you considering a remote option until children under age 12 can be vaccinated, given the Delta variant? And I understand the way that person wrote that question is a bit ambiguous. It's unclear whether they mean everyone remote or remote just for that age group or a voluntary remote option. So I wanted to obviously get your thoughts on that, but really let's take this as an opportunity maybe to go into what some of the virtual learning and remote learning options your districts are offering right now. And let's maybe start with Matt here since we started with Jason last time.
Sure, we definitely have a virtual option, and we recognize that there are families that are not going to be able to or are not willing to send their kiddos to school, and we appreciate that and we respect their decisions, but we want to be able to educate them, and we feel like we can provide a good education for them in that virtual setting if need be. We have put some more parameters around it this year just because we felt like we had some people that may have abused it a little bit last year as far as not doing what needed to be done. So we've tried to have a more detailed plan with what the expectations are from those parents. We just want to make sure that the kids are actually getting the education that they need. And we still believe that in-person education is the best that we can give our kids. And truly, especially down at the elementary levels, it's really hard to replace a teacher in the classroom in front of a kid. And so we're going to do everything we can to keep our kids in school, but we do understand that we need to have those options out there.
And for our next question, I think this is one that I think anyone could chime in with advice on. This is from Paige and Norman. And her question is, how can I encourage my 7-year-old to wear a mask if others are not, and it's not a requirement as it was last year? What would you all offer for her?
I guess I can go first. I think I would offer that she should probably have a conversation with her children before going to school about how important it is to wear a mask, regardless of what the other kiddos are doing, and how proud she will be if he's able to keep it on all day long. And, just make it about how important it is to keep it on regardless of what other people are doing.
That's great. Does anyone else have advice on that?
At least for us, we've been trying to equate the recommendation to wear a mask with the recommendation to wash your hands. That's not something we've ever required. It's something that I think everyone acknowledged that you should do. And we have always encouraged students to do that. We obviously ramped up those efforts last year. And I think when you equate it to that, whether you're a parent or a teacher, on here's a practice of good hygiene, and we're going to recommend that you wash your hands, and you start practicing just like you practice washing your hands at an early age. You would practice wearing your mask correctly. I think when you equate it to that, even kids at 7 years old see that some people wash their hands and some people don't, and some people do it correctly as their mom showed them, and some people don't. But you can still encourage someone to follow good hygiene habits and maybe not feel so stigmatized if they're one of the few who are following those.
And if anybody else is okay and moving on to another question, I would be remiss if I didn't give Jason the opportunity to talk about the E3 virtual curriculum. I know I've talked with some parents who are really grateful that became an option again this year. You all kind of built that from scratch last year. You didn't used to have a fully online virtual option for students, and now you do. I was wondering, Jason, if you could go into that a little bit and what that means for families to have that.
Great, thanks, Nuria. Yes, our full virtual option is, we refer to that as our E3 option. It's available to students pre-K through 12. And we've been advertising that all spring for parents who wanted that as a choice. And while the deadline has officially passed, we also know that with changes in the COVID landscape and the Delta variant, there may be parents who are second guessing maybe sending their kids to school in person. And so we would ask that if you feel like you have changed your direction, contact your school's principal and talk to them about the options of getting enrolled in E3. Right now, we have over 1,000 kids who chose that option, or 1,000 families who chose that option for their kids. Moving forward, because I think others are also asking, their questions are alluding to what are contingencies if it gets worse, and some of those. That's one of our big prep areas that is new to our first day of school, and that is being ready to pivot into a virtual setting by site if necessary. And I really think our superintendent put it best. We start at the lowest level, pivot a student into virtual learning if they become positive or exposed to COVID or show symptoms, pivot a class if we need to. And then if we must, and we've had districts that had to do that, if we have to pivot a school into virtual for a short amount of time because there may be an outbreak, then we would do that well prior to making decisions that are district-wide. And so that's where we're putting our efforts to be prepared, make sure students have the practice of learning online, that students have devices and hotspots, so that if we have to pivot, and we hope we don't, but if we do, then we're prepared to shift for a short amount of time to a virtual setting, either by class or by school, And those would be our contingency options.
Thank you so much for explaining that. And I'm going to go ahead and move on to the next question here. This is from Rodina and Norman. And this is for anyone and everyone who wants to chime in. Why are there not evening vaccine clinics at the schools so kids can get vaccinated? And just to clarify for viewers, there have been schools that are hosting or have hosted vaccine clinics. My understanding, at least in OKCPS, those were often during the day. Rodina here is asking why they're not in the evening, and I believe, if anyone can correct me here, that vaccine clinics kind of in general have started to taper out a little bit as far as the ones being hosted in schools. So if we could just maybe jump into that a little bit and explain why we're seeing fewer of those and maybe why we didn't see them in the evening hours.
I would start off on that, mine is, because we've got one scheduled, coming up, it's after school starts, but we did, one of the things we recognized we wanted to do it in the evening hours. We were starting it immediately after school, so parents can be there with their kids right after school and running it for several hours in the evening. That'll be August 25th is when we're doing that. We're actually partnering with the Chickasaw Nation in doing that, and very thankful for their partnership and their willingness to work with the school. So
That's great to hear. Is anybody else able to chime in on that subject?
I can just tell everyone that our OU Health Clinic in the Children's Hospital on the second floor does offer vaccination, and it's open until 5:30, so it's not super far into the evening, but at the start of the evening anyway.
And question here for Jason, just on that subject. I know it's technically the City County Health Department that really directs when and whether those clinics happen. But are you seeing increased interest? Is there a possibility we see those in OKCPS schools again soon?
Actually, yes, we have seen. While we were a little disappointed in the turnout with some of our early vaccination pods, we have seen an uptick in interest here recently, and obviously, I believe it's because of the severity of the Delta variant. And so we are planning on having vaccination pods at schools during the school day. And obviously the same requirements as far as parent consent and parent presence that exist now would still apply. And so, yes, we are looking at offering vaccination pods, and we'll get that out on our website and our social media pages as soon as we have the dates and locations. But that is definitely one. We want to get the first couple of days of school started and then give parents an opportunity. And I will say to Rodina, I think that's a wonderful idea. Our data showed that they started to taper off when we first held vaccination pods, but the idea that now parents have to bring kids is a good reason to reconsider offering a diverse number of times that people can access vaccination pods. So that was a great idea. We appreciate that.
Great. And so we just want to take this opportunity to encourage anyone watching, if you have questions at home, please feel free to put your questions in the Facebook live chat or in the YouTube chat. But we're going to go ahead and continue asking a couple more questions here. So this one's for our school district leaders. COVID-19 has caused significant disruption to student learning. How will your districts facilitate academic recovery?
I think mind, I'll start. One of what we were in person all year last year, but we also recognized that there were attendance issues due to quarantines, students being sick. It caused disruptions throughout the year. We recognized that, and we were also out an entire spring, 9 weeks prior to that. So I think anyone that thinks that there's not going to be some gaps with those things is anyway, with that being said, some of the stuff that we've done is we've added reading interventionists, reading specialists in our early childhood elementary buildings. We're really looking at trying to identify where those gaps are, where they're missing. With our teachers, done a ton of professional development this summer for our teachers, offering PD all summer long. To help them identify what those are. Also looking at different curriculum that we can implement that will help us find where that is and what we need to do to get those gaps lessened over time.
And Jason, I know you all are coming from a very different experience in this past school year. Can you jump into maybe how that academic recovery is something that you guys are focusing on and how you're addressing that?
Yeah, we have some targeted interventions in Oklahoma City that we have in the works to implement as soon as school starts. We've got some positions in place. One that immediately comes to mind is our student learning assistants that are targeted at the third and fourth grade, knowing that you can predict the success academically moving forward on reading comprehension and reading fluency early on in the third or fourth grade. We know that it's important to get them that foundation. So we've hired student learning assistants for those targeted grades, and very much as Matt alluded to, the reading interventionists and reading specialists. But we've hired some reading interventionists and math interventionists, not only at the middle school, but also at the high school. Probably one of our most exciting additions are our student assistance specialists at the middle school and high school that really will function very similar to counselors. We know that it is not necessarily a time while learning recovery needs to take place to add a significant amount of mental or emotional stress to our students. So to help manage that at the same time while trying to get them caught up, we have student assistance specialists at our middle school or high schools that will work with our students to make sure their social and emotional well-being is still being taken care of while we're meeting their academic needs. And we feel like we can do a better job of meeting their academic needs in the classroom if we have those supports on the social emotional side. So some really targeted things with trying to lower class sizes and with trying to get some intervention directed at students who show the need.
Awesome. And we did just get a question from the chat, so I'm going to read that out. This was a good one for the doctors. The question is, what is the likelihood that my child could become severely ill with the Delta variant? And do children have a better chance of recovering from COVID?
I think the likelihood of severe illness depends on quite a few different things. Previously healthy children typically do not become severely ill, although, as I mentioned earlier, we are seeing previously healthy children coming in with COVID pneumonia and requiring oxygen. And so I don't know, Mary, if you wanted to add anything to that.
We'll just add the severe inflammatory illness that we see in children that we don't generally see in adults. That's still very uncommon. We're starting potentially to see a little bit more of that. And this is basically a multi-system organ failure where your body's immune system becomes overreactive and you start having inflammation in and around the organs, including the heart, on top of the lungs, kidneys, liver, etc. And that's a very unique almost to COVID-19 in young children, especially very young children.
Thank you for mentioning that. So yeah, in our hospital system for 2020, we saw over 80 cases of MIS-C. So it is rare, but that's a lot for just one facility.
All right, we have another question from the chat here. Are school districts encouraging their personnel to get vaccinated? And what is the likelihood of a vaccine mandate taking place for educators? And I think before some of our educators jump in on this, I believe Senate Bill 658 would have some bearing on this. But you all are, it's my understanding, you're encouraging this, and then what's the likelihood of a vaccine mandate?
In Oklahoma City Public Schools, we are encouraging. We know that 60% plus of our employees have been vaccinated. We use a self-reporting system, and over 60% report that they have been vaccinated. And what we found is that there's a significant number who, as is their choice, choose not to disclose whether they have been vaccinated or not vaccinated. But as we've had maybe cases or close contacts, we've had some of those individuals that we didn't have information on, again, that revealed that, yes, actually, I did get the vaccine. So we know that we have 60% plus, and we are constantly encouraging our employees and trying to provide as many opportunities for them as possible to actually take advantage of the vaccination pods and go get vaccinated. We will not be able to mandate and don't look for that option to mandate vaccines for for our employees. We just want to encourage them to get vaccinated and stay safe. But we know several of them have personal choices or reasons why. But we want to educate and dispel any myths if they have any misinformation. And that's one of the reasons they're not getting vaccinated. We want to educate and encourage.
And then Matt, what say you on that subject?
Yeah, so fairly similar as far as I think the percentage. We haven't kept track of specific percentages, but we worked with our local health department when it became eligible for teachers to get vaccinated, and actually helped schedule times with our local health department. So, and had a large majority of our staff that went in and took advantage of it, of getting vaccinated immediately whenever they could. And I think encouraging it, and like I said, like Jason said, dispelling any myths that might be out there, I think is really important. But we also understand that it's a people's choice, and legislation is definitely not going to let us mandate anything, and I don't think we have any desire to mandate it here at this point in time.
Right. So next question here is for our district leaders, and also for our doctors. Please feel free to answer this as well. How are schools affected when they are one of the only, if not the only, locations in their community where there are things like mask mandates or other COVID precautions? Obviously now we don't have mask mandates in schools, but when I think about this time last year, and we're thinking about when we're going to start opening up our schools, and some of these schools and different communities were going to be the only place, or one of the few places in their communities where there would be consistent mask wearing, versus it being less consistent in their wider communities. Just how does that impact the school? Do we see cases starting to enter the schoolhouse that maybe wouldn't have if the wider community were more consistent about this? I'm just curious, for both the doctors and our education leaders, how maybe that schism might impact a school system.
I can take that one because we actually talked about that today. I don't think it impacts us to any severity. It did cause us to rethink our strategy on providing PPE. We've always placed hand sanitizer at the front and made it readily accessible, but because so many people were wearing masks and you had to wear masks almost universally, after we provided an initial stockpile of masks to make them available, we didn't really have too many people taking advantage of that. But now what we see, and what you see in some businesses, and you'll see in our schools, is we'll have hand sanitizer and mask available. If that way, if they don't have one, as they're exiting from some of these places that aren't encouraging them as much to wear masks, we at least have disposable masks right there at the front when they enter for anyone who may need them. And so it did change our kind of supply list a little bit for our schools. And that was an odd difference, but it was a noticeable difference.
And Matt, I also would like to ask that about your experience. Were Sulphur Public Schools some of the only places in Sulphur that were requiring masks, or did you all see more places in your community also participating in those measures?
So last year we never did make a full-blown mask requirement. We highly recommended, especially in our indoor facilities, especially when we got into basketball season and indoor sports. So there was never a mask mandate, and that was pretty reflective around the community as well. Very few places were requiring it. Some of the businesses that did require it, but not everywhere.
Gotcha. And just a follow-up on that for our two health experts here. I remember speaking with our state epidemiologist, Julianne Stone, and she was telling me that the fact when there wasn't a consistency between what the community was doing and what the schools were doing, that made it difficult to contact trace, and made it difficult to tell if a student caught COVID-19 from their community or from their school. And I was just wondering if from your side of things, does that pose any challenges in terms of locating the origin of a certain transmission, or just in general any complications that come with those two sides not quite being in step with each other?
Oh, sorry, go ahead, Mary.
No, we please feel free. Go ahead. I'll come after you.
So the data that came out of schools from schools last year was actually really, really good compared to community transmission. Most schools did a really good job of, preventing COVID transmission in the schools. But we're talking, I don't even really like calling it COVID-19 anymore. I call it COVID-21 because we're talking about a completely different virus now. And so if we're doing all of that mitigation last year, or even partial mitigation last year, in some schools that didn't require masks, it's not as big of a deal when you have a virus that doesn't really infect children and cause severe infection the way we do now. Like, the virus is different. The other thing I would mention is that masking not only prevents COVID, but it also prevents all the other respiratory illnesses that we have to deal with in schools every year, including influenza and RSV, and could potentially help teachers, prevent them from having sick days and things like that.
And I'd like to just chime in on addition to that. Keep in mind that the cities that had a mask ordinance at any time last year still continue to have lower velocity of increase of COVID infections, even since the mask ordinance has been expired. So we have a comfort level in the cities that have had mask mandates versus never having a mask ordinance, and we still see a difference in the spread. So people that have been in an area where you had to mask up, it's not as difficult to slip back into wearing a mask when you go to the store, or when you go shopping, you walk down Main Street, or you're going to be around a crowd, than if you've never had to do it, because this is now going to be the first time that people are really going to be pressured to be masked in a lot of these towns. Whereas many urban centers, and even in not just talking about Oklahoma, but let's talk about across the country, we see it equally across the country. If you've ever had a mask ordinance, it's easy to remask, even if you're not being required to. I'd also like to say one thing. When we're talking about kids who cannot be vaccinated, I don't think it really matters where you get infected. It's a responsibility for not just the educators. This is not an educator problem. This is a problem of every person in our community to keep those children safe, because they cannot be vaccinated yet. It is our responsibility to do our part so we don't spread it to them until we can get them vaccinated.
Thank you. We have another question from the chat, and it's also for the doctors. Do you anticipate that an outbreak within these school systems could overwhelm hospitals in Oklahoma City? Dr. Clarke, I know you're not in Oklahoma City, but Dr. Tiungo, I know you are. Feel free to jump in.
So I don't know if the community understands the RSV surge that we have happening right now. Respiratory syncytial virus is typically a wintertime virus, but we think because of the timing when we took all of the masks off a few months ago, that allowed it to surge. And so we have a very full hospital with RSV, as well as COVID we're starting to have more COVID pediatric cases. And so yes, it is absolutely a concern, not to mention we have limited, staff and limited respiratory therapists and limited nursing. And so, yes, we're here for the community. We're here for our kiddos when they get sick, but it is a concern that if schools head back without masks on, with this very highly transmissible airborne virus moving through indoor places, yes, we're concerned.
I want to make one extra comment that I like to make everybody aware of. When we fill up the hospital, and I'll tell you, Stillwater Medical Center has been on divert for the last 2 days. We have no room in the inn, so to speak. When we fill up the hospitals with RSV and other conditions already, and we've already seen the hospitals across the state be very busy this summer with a lot of things that people have been putting off for a long time, and coming in with conditions that need to be taken care of that have been kind of less a priority. We've seen this in all of our clinics. The numbers that we're seeing is just astronomical, and I'm sure the Children's Hospital is the same thing. When you have a hospital that's filled up with either children or adults or whatever, for any reason, think about the normal things that are going to occur in everyone's health. So let's just say we have a full hospital system for our childhood patients, and we have a child that is in a emergent situation, and we have nowhere to put them. No fault of any parent, no fault of anybody else, but we have no room. So not COVID, all the other things, and that goes with the same as the adults, but the children specifically, because we don't have nearly as many childhood ICU beds as we do adult ICU beds. So we're really concerned that we're going to start seeing the normal wintertime things that we will get, and we'll need that hospital ICU bed, but we're full with COVID and the other things like RSV. So we expect this to get much worse.
Thank you. We have one last question from the chat that I want to squeeze in because I think it's a good one. This is from Kyle. He asks, is there any benefit to a child wearing a mask if he's the only one doing so?
I would say yes, because the level of virus that a person gets when wearing a mask is less than the level of virus that you will inhale without a mask. And that's proven over and over and over. And we know that people who had a mask on, even if it wasn't a great mask, if it was only 2 layers of cloth, you will get less droplet transmission through your mask. So if it was my child in school and no one else was wearing a mask, he would have it on.
Thank you. That's a great answer. So we are coming up at the end of our time, so I wanted to stop here and thank our panelists just once again for joining us, and ask panelists, do you have any final words of wisdom that you want to share with our viewers today?
I'll chime in first. Please, if you are an adult and you are able to be vaccinated, please go do so. If you have teenage children over the age of 12, please get them vaccinated. If you have children that are in college that are over 18 that are making their own decisions, which I deal with every day being in Stillwater with Oklahoma State, please encourage your children who are young adults to please get vaccinated. We are one team and we have to do all this together. We cannot do it 50-50.
And Dr. Tungu, let's go ahead and move on to you if you have any final words for us.
Please go get a vaccine. I mean, I'll just say everything that Dr. Clarke just said. And you know, if you go get a vaccine tomorrow and you're in school, you know, even that first dose, we know it will have 33% protection against the Delta variant. So if you get vaccinated, you really need to wear a very well-fitting mask. And with the increased transmissibility of this variant, we would advise people to wear more medical grade masks than cloth masks. And, you know, I just encourage all the parents and all the families and everyone in my family, whoever's listening who doesn't believe what I have to say, please go get your vaccine.
And let's go ahead and move on to our 2 district leaders. Matt, let's start with you. Any final thoughts for us, especially as you're getting ready to open your schools again to the public?
I think probably if I say anything is I hope that everybody uses grace and kindness through this whole process, as all the school leaders, not just myself, not just Jason, but all across Oklahoma and the United States are doing our best to keep our kids safe and to get them a great education. And so grace and kindness goes a long ways, and thank you guys for having me on.
Great. And let's cap this off with Jason. Any final thoughts for us?
Yes, I think we've heard some great encouragement to get vaccinated. For our families and our communities, if you would like to get vaccinated and you just don't have the information or you don't know where pods, I would still encourage them to call our 587 field number. I know that is typically utilized for educational needs, but we feel like it's important to provide that information to our families and community. And so we will work with you to get the information and how you can get vaccinated. And then lastly, I would just say that while we know that we can't require masks, we also know, and I think we've heard from our two medical experts here, who we appreciate sharing the information. But I think we've heard that while we can't require it, if we will wear the mask, if our students and families will wear the mask, we know that we have a better likelihood of staying in school. And we are committed to staying in school. We're committed to having students learn their first instruction and best instruction here at our buildings. And so while we can't require it, we know that if you do, our kids have a better shot of staying in school.
Great. Well, with that, thank you to our panelists for joining us and everyone watching. Thank you for spending your evening with us. Everyone, have a great night.
You have to bust a lot more myths.
Me too.
Talking about magnets tonight.